Rhinoplasty, also known as nose job, improves facial harmony, proportions and deformities of the nose. It is also performed to correct impaired and weakened breathing caused by structural defects in the nose. Nose is one of the most important parts of the face. It is undoubtedly among the first features people notice on the face. And many of us are not born with a perfect nose, yet all of us crave for one. The distinction of the nose when it comes to an individual's appearance is surely unquestionable. It being in the center of the face is directly noticeable. That is the reason any deformation or shape error is impossible to hide. There are many people who have to face impaired breathing issues as well due to the structural defects in the nose. Rhinoplasty is done to redesign the nose so that it complements and enhances the overall facial features and attractiveness. The perfect candidates for this procedure are those who have aesthetic issues with the nose, such as a very large nose or a small nose, a bulging tip, functional issues such as snoring or difficulty in breathing, as also visible deformities. And that's why it is very important for you to understand that rhinoplasty or nose reshaping job is amongst the most difficult of all cosmetic surgery procedures. Poor surgical technique can lead to permanent deformity, so you need to choose your surgeon very carefully, and at the same time, you must know the basics of the rhinoplasty procedure. Viewers, a world-known plastic surgeon, Dr. Sanjay Parashar, is here with us today to tell us all that we need to know about rhinoplasty. Dr. Sanjay, a very warm welcome to you first of all.
Thank you.
Now, there are a lot many out there who would need your help correcting the deformities of the nose, or maybe getting the perfect nose by reshaping it. So let me start with a very basic question. How would you define rhinoplasty, or as we popularly call it, the nose job?
See, rhinoplasty is reshaping of the nose, okay, and it is in strictest sense related to cosmetic enhancement of the nose. The rhinoplasty that is done to improve deformity or to improve breathing is called septorhinoplasty or reconstructive rhinoplasty. So the popular nose job or rhinoplasty is the cosmetic term, and that is done to, like you said, to improve the shape, to reduce the bulbiness, to thin the nose, enhance the nose, augment the nose. Whereas reconstructive rhinoplasty or septorhinoplasty are for people who have had suffered from trauma, accidents, birth defects, or a nose that is causing them airway problem because
Breathing
of structural
problems.
breathing problem.
Right. Also, there's a lot of talk about celebrity rhinoplasty. Does it mean that I can get an Angelina Jolie nose, or we can just get a nose which looks like our favorite celebrity?
That's not correct actually. Celebrity rhinoplasty is a term given to a nose job or nose surgery just to refine the nose that would fit on that person, so that others would envy that they want that nose. That's actually the concept of celebrity rhinoplasty.
Okay. So when patients come to you, what do they look for, and what are the trends about rhinoplasty?
See, majority of the people, particularly in India, there are two main issues. One is either the nose is too flat and they want to enlarge it, or they want to augment it, they want the bridge higher, or they would have a big nose or chubby nose where they want a sleeker, slimmer and thinner nose. So these are the main commonest concerns that patients come up to us for.
And then what is the pre-operative analysis of each individual separately?
See, what happens when a person comes to our nose job, obviously they have certain things in their mind.
Sure.
It's important first of all to counsel them what is possible and what is not possible. That's the most important step. So what we do is we physically analyze the nose. Is the nose really disproportionate to their face?
Okay.
Or what they are trying to point out on the nose, is it really visible to people? Because many a times they may think that they have a problem in the nose, and an expert like me would think that it's not required because it aesthetically fits your face. So that's the most important analysis that we have to do. Then the second part of analysis involves computer imaging, which is a very handy technology now that we have. It's called Chrysalix, where we can take a 3D imaging of a patient's face and the nose, and then we can change or tweak the nose in different parts to see how it would look on that person's face.
Okay.
So there's a very good communication tool between us and the patient to understand what is right for him or her. If you make the nose a little bit small, it may look nice. If you try to make it more small, it may not look nice, and they would agree that yes, it looks abnormal on me.
So doctor, there are a lot of rhinoplasty procedures, and I've also heard about a non-surgical procedure. Would you want to elaborate on the procedures and the non-surgical procedure as well?
Rhinoplasty basically can be surgical, of course, with the help of surgery, or it can be non-surgical, or it's called medical rhinoplasty. Now, surgical rhinoplasty, of course, is the gold standard, and that is done to permanently change the shape of the nose. It could be done something called as closed tip rhinoplasty, where everything is done from inside the nostril without any incision scars on outside, or open tip rhinoplasty, where just a small incision is added to the base of the nose that could allow us to see the nose and change. So that's open tip rhinoplasty. But medical rhinoplasty is the shape of the nose is changed just with the help of injections. So it's very useful for people who have small deviations, small depressions, small contour changes, or somebody who has had surgery in the past but they still have some unevenness. You could easily improve that without a surgery, and that's medical rhinoplasty.
So then there would also be risks or limitations associated with rhinoplasty?
The surgical rhinoplasty being surgery, obviously there are risks and limitations. So that is why it is very important, first of all, we counsel the patient. We see what the risk and benefits of that procedure would be for that patient, whether it's worthwhile to go through that procedure or not. Having said that, after rhinoplasty procedure, there are cares that needs to be taken, there are medication that needs to be taken. So an experienced surgeon would analyze that and would try to do minimal thing that could give maximal enhancement, and that minimizes the risk.
Then who, according to you, would be a good candidate for rhinoplasty?
The rhinoplasty is for people who are worried about the nose. Okay, they identify a certain part of the nose that is bothering them, be it a large hump, be it a twisted nose, be it a chubby thick nose. If they can identify that, they are suitable for rhinoplasty. On the contrary, people who think they just want to change the shape of the nose to look like a celebrity, they are not ideal candidate for rhinoplasty.
Great, doctor. What all can be done through rhinoplasty? Can snoring be cured?
Snoring, if the snoring occurs because of the nasal obstruction, it can be improved by rhinoplasty. Sometimes the snoring is because of throat. That cannot be improved with rhinoplasty. Or if somebody is suffering from sinusitis, where the sinuses, which are these air cavities in your
blocked.
face, gets clogged and filled with water, that is because the drainage system is not working very well. So they do benefit by a procedure called septoplasty, and they may require additional procedure that is performed by ENT surgeon to drain the sinuses.
Thank you very much, doctor, for those valuable insights about rhinoplasty. Dear friends, there is one thing I would like to tell you. You must have a positive approach along with the clarity of fact that you should opt any cosmetic procedure only when you actually need it. Please do not get carried away by rumors. You must remember that only the expert hands of an experienced surgeon can give you the desired results. And that's why I'm going to once again request our expert, Dr. Sanjay Parashar, to convey that message and affirm that, as also tell us, doctor, that how can we find the right doctor in plastic surgery and also the perfect center.
First of all, expectations are important, realistic expectations. It is not possible to create something totally different out of what a body has or what naturally God has given us. It is possible to only modify it. So it's very important for people who are looking for any nose surgery to be very realistic about it and discuss it openly with the doctor. Now your next question is, who's the right doctor? Of course, rhinoplasty is performed by plastic surgeons and cosmetic surgeons. So they are the one who are trained in facial plastic surgery for many years to be able to perform rhinoplasty. But many a times rhinoplasty is also performed along with ENT surgeons, ear, nose, throat surgeons, who deal with the functional part of the nose. So plastic surgeons sometimes work with ENT surgeons to operate on people who have both visible problems and functional problems as well. But it's important that they should do a bit of research on the online, to see the qualification of the doctor, to see the experience, how many number of years of experience that person has. To find the center, again the credibility of the center is important. What kind of accreditation that center has, who are the team involved in the medical management that they would go for. So I think these all information needs to be collected before they think about doing rhinoplasty.
Thank you very much once again, doctor. Dear viewers, I hope that you found that information helpful. In case you want to contact Cocoona Center for Aesthetic Transformation, please use the toll-free number 800 36 26 36, or you could even log on to www.cocoona.ae. Feel free to contact them. You're going to get the best support.